Welcome to Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson. This year, we are focusing on preventing burnout in healthcare and mental health. And today, we have a special guest with us. Dr. Kertia Duga, known as Middle Fertility Doc, seamlessly connects gynecological care with IVF expertise. With over 15 years in healthcare, she stands out as a board-certified naturopathic physician, emphasizing nutrition, exercise, and holistic practices. As creator of She Does Medicine, an innovative online clinic for natural and integrative fertility, Dr. Duga creates personalized protocols to address the root causes of infertility. Motivated by personal loss, she dedicates herself to enhancing women's health and fertility, particularly within the Black community. Her unique approach combines medical proficiency with a natural focus, empowering women to navigate fertility challenges, fostering optimal health, and expediting the path to pregnancy. Beyond her healing role, Dr. Duga is a passionate dancer and advocate for women's well-being. And without further ado, let me bring on Dr. Duga.
Hello.
Hello, thank you so much for being here today. I'm really excited to hear everything that you have to share with us and how you want to, just the healing role that you've decided to use with women, because I know infertility is can be quite devastating, especially when women have made the choice sometimes to delay pregnancy to pursue a career or other interests, sometimes even travel. Would you like to tell us about some of that? I don't know any of the statistics actually on infertility and how that impacts women.
Yeah, so I it's infertility is something that I didn't even see myself doing per se. When somebody asked me the other day, how'd you get into it? And I responded, it was just destiny, you know. I really started my healthcare career as a nurse. I worked in the ER for a little while,
Okay.
and I did not like the medical model. I just speaking of burnout, I actually burnt out 2 years in as an ER nurse.
Oh, wow.
And I was working at Jackson Memorial Hospital in Miami, which is the largest teaching hospital, one of the largest teaching hospitals here in Florida. And I really got into medicine to really help people get healthy. And that is just not what we were doing as nurses and physicians. And everyone around me was burnt out, from nurses to physicians to the patients, right? And so I remember I would go in and give meds, and my patients would be like, well, how do I get off this blood pressure medication? And how do I? And then, with the little bit of knowledge that I had, I would educate, but even I didn't really know what to tell them. And so, long story short, I decided to go back to school and decided to focus more on lifestyle medicine, health promotion, more of a holistic approach. And after I left, I was doing like general practice. And during that time, I had a girlfriend who had decided to become a single mom by choice, and was going through fertility treatments, and it was like failure after failure, and I just watched
Mhm.
her fall into a deep depression. And I'm that girlfriend that my girls come to when they're having a health crisis. And so the fact that I wasn't able to help her like really affected me. And so I decided that I wanted to specialize, and at the time I was doing some research to figure out where I wanted to specialize. And then I was seeing the stats on um, women having trouble getting pregnant. I think at right now the stats is like between 60 to 80 million people worldwide are dealing with infertility.
I had no idea.
And yeah, and the number is growing, and it's becoming an epidemic at this point. But I think the reason why a lot of us don't know about the growing problem of infertility is because it's such a taboo topic, especially like amongst the Black community. That's not something that we openly talk about. And I think part
Right.
of it is because of the misconceptions and the myths around Black women's fertility. Like, Black women are supposed to be hyper fertile, right? Like, we're supposed to have babies very easily, but
Mhm.
that is just not the case anymore, if that was ever the truth, right? And so, um, that's how I got into it. I just out of curiosity of figuring out how to help my friend. And then fast forward, I was like a year into this specialty, and this was in the middle of the pandemic. This was August.
Mm,
Pandemic started January, February that year, March. And then in August, we were in the thick of it, right?
right.
And I remember I was like studying like for the specialty, and I got a call from my aunt in Florida. I was living in LA at the time, and she said, and my peoples are from Haiti, and she said, "Well, we're receiving lakai," which means you finally gonna have to come home. We haven't seen you in a while, but you're gonna have to come home. And I said, "Why?" And she said, "Eda mui," meaning Eda passed away. And I said,
Ah,
what do you mean she passed away? She just liked to comment on my Facebook post and everything was fine. And she was like, she died after giving birth. I said, died after giving birth. I didn't even know she was pregnant. So she was
ah,
like in her 40s. This was like her third baby girl. And my cousin and I were pretty close, right? Some
mm,
people aren't close with their cousins, but I was close with her. In undergrad, she would come visit me on campus and take me to her house and cook for me, and we'd catch up. Like we were like girlfriends. So I was
right.
like heartbroken. I
I
was
can't
really heartbroken.
imagine.
And so left LA, came to Florida. I gave the eulogy,
Oh,
and it was like I don't know. And the moment where I knew that this work was like going to be my life was when we were at the cemetery and we were watching, we were there for the actual a burial, and I was in the front, like I was like front row seat, and my her dad, which is my uncle, was on my right, her brother was on my left, her mom was behind me, and I'm literally watching it, watching the casket go down. And I've never heard myself scream like this before. I don't know if you've ever heard of like a raging scream, but it was like a raging scream just came
mhm,
out of me. And it was just like this like, I'm tired. Like, I'm tired of us Black women being at the worst of the statistics. Like, if you look at the
right.
statistics for Black maternal mortality, it's terrible. Like, I don't have the numbers off the top of my head, but when we're comparing Black women's maternal mortality to those of other races, we die at 2 to 4 times at a greater rate than other women of other ethnicities. So that's when it was solidified for me. I was like, okay, like, I'm gonna stay in this work.
So I wanted to pinpoint, and I'm so sorry for your loss. I know it, when you have those deep family relationships, it's difficult to see someone so young because we don't expect them to pass on. I wanted to go back to the comment you made about Black women being hypersexual and the problems with infertility and it being taboo. And I think one of the first things that came to my mind is that economically, and even how we are presented in the medical community, is it something even feasible for many women in the Black community to even get that treatment? Because my understanding is that it's quite pricey for the medical model of treatment for
Mhm.
infertility.
Oh yeah, it's definitely, the cost is definitely a barrier for us. Um, I could tell you the numbers because I'm always talking about the numbers with potential patients, um, but they vary. Like, if you're talking about one IVF cycle, it ranges from 6K per cycle till about like 12K per cycle. Um, and that's like on the lower end. It could be more depending on the difficulty of the case. Like I had one woman that I was talking to, she said this doctor was charging her 25K per cycle because her
Wow.
case was so complicated. So it really depends. But nowadays, one cycle is really not enough to achieve the success that people are looking
Right.
for. Nowadays, you go into IVF clinic, they're selling it in packages of 3. So you got to
Mm,
be prepared to do at least 3 IVF cycles in order for them to discern whether or not it's been considered successful or not. So you're looking between, on the lower end, 18K to 36K, but it takes an average of 6 cycles for people
mhm.
to achieve success, so double that.
Wow.
So yeah, cost is a barrier. Cost is definitely a barrier and causes a
And
lot
then
of,
it may not even work.
and it may not even work. So when we're talking about um success rates tend to be lower for us,
Mm,
because we tend to have more complicated cases, and we can get into that later. Um, and we tend to be older, which requires, um, which decreases the success rate.
mhm.
IVF is very much dependent on age, and so the older you are, the lower the success rate. So there are multiple factors that are working against us when we go down that route.
And I'm curious how stress and burnout plays a role in that because I'm thinking of the career professional. She's in a role in a hospital in corporate America. She's
Mhm.
trying to continue to be successful because she got to get this paper for them IVF treatments. Does that, whether you're using the natural path or whether you're using a naturopathic medicine as you advocate for, or even the medical model, does that impact fertility?
Does what impact fertility? And I'm
Just
trying to.
experiencing stress and burnout
Oh,
and all of that.
for sure. So there is this. The New York Times put out an article titled. I'm going to paraphrase. Um, it's called a medical career at a cost, and it's like, semicolon, infertility. So essentially, what
Mm,
they're saying is, there is a pattern amongst female physicians, of like increased rates of infertility among female physicians, and they're talking about the stressors of pursuing a medical career, a career in medicine. Those long hours, days that you go without sleep when you're in residency, just that on your body over time. And by the time you feel ready, you get to that point in your career, it's like they can't get pregnant.
wow.
And it's because of the stressors of the whole path to get there. So absolutely, stress has a lot to do with it. I talk about it in my personal work with patients. I'm always, assessing their stress response system. So the way that I like to explain it to patients is, think of it this way. So your body, your nervous system has 2 operating systems, right? So there is like the sympathetic system that most of us know as fight or flight. And then there is the parasympathetic system that most of us know as rest digest. But I would add to rest digest is reproduce. That
Mm,
mode is the mode that your body needs to be able to be in, um, and able to in order to reproduce. And so when they come to me, there is an assessment that I do, a preliminary assessment, just to see what their nervous system is doing. And 10 times out of 10, there is a, what I call it, they're in sympathetic overdrive, meaning their body is mostly stuck in sympathetic and fight or fight mode, and they're not able to flex into that rest, digest, and reproduce mode, because our society, this modern society, requires you to like hustle. This is hustle culture. Like, this is like,
yes.
you sacrifice sleep, you sacrifice your health for the hustle, right? But it comes at a cost. And
Absolutely.
that's what people are being met with when they're dealing with fertility challenges. It's like, oh, I like the lifestyle that I've been living has been costing me my health and has been costing me my reproductive health and my reproductive potential. So that is literally the center of my work, is talking about that.
And I'm curious whether you see the same thing I've seen when I've worked with uh, potential medical students who are Black and Indigenous people of color. Not only the stress of medical school, but I've found that they are bearing multi-generational stress because they are caring for their family members in a variety of different ways, and it's been so difficult for them to release that caretaker responsibility role. So you're shaking your head. Absolutely.
You're talking to me. You're speaking to the choir. Like that was me in medical school. Like I like look at I've been looking back at my life and being and I'm like, girl, how did you do it? Like like first of all, what were you thinking? And then like second of all, like how did you do it? But then like when so I'm first generation Haitian American. So that means like I'm the first in my family to go to college. I'm the first, right? So I'm like leading the way. And so I'm that person that like left home but still had financial responsibilities, right? And so when I was in medical had financial responsibilities, had, big sister responsibilities. Like I remember when I was in med school, my brother was in the middle of some serious charges and
Oh,
went to prison while I was in med school. Like this is like
can't imagine.
this is real shit. Like I'm sorry if I'm not allowed to cuss. This is
You're fine.
real life struggles of
Right.
coming from a Caribbean family, being first generation American, trying to achieve the American dream. um and you and your family is not rich, like
Mhm.
considered to be living in poverty essentially, right? So I was dealing with that, and then like my mother became single at the time, and like always worrying about her, like was she financially okay? So it's stressful. It's extremely stressful, extremely.
And I think you brought out another very good point. Just the guilt of pursuing a better life and knowing that your outcomes are going to be better than those that you love who are not choosing paths to that will change the trajectory of their lives.
I actually don't know if I felt so much guilt, if I'm being honest. Like I was like, I'm out. Like I no, for real. I was when I hit high school, like I was like serious about my life since middle school. I was like, where are we going for high school? I went to a medical magnet school. Like I started studying medicine when I was in high school. Got a full ride to the University of Miami. Like I was dead. I was serious. And I
Okay.
did not feel any guilt. It was just that extra burden that was just always there that I had to take care of. I don't know. Like
Right.
I think like being a Black woman in your family, there's that expectation that you are going to, and maybe I can't speak for all Black women, just particularly in my situation, there is
Right.
this caretaking responsibility that I always carried.
Well, I mean, I've seen that replicated numerous times, and in over 23 years, it's pretty much the same story. That seems to be our cultural inheritance, to be the caretaker and sacrificing yourself. And you're saying that
Mhm.
it leads to infertility. Um, do relationships shift a lot? Like, do you find when in whether they're married, if that brings upon difficulty because of the lack of fertility?
Oh, most definitely. There are there are couples who don't make it through
Mm,
the fertility challenges. Like it tears couples apart. But it doesn't have to. I find that there is just a lack, just a sheer lack of social support. Like I remember I was
right.
talking to this one woman and she was just sharing her stories, and her issue wasn't getting pregnant, her issue was staying pregnant. So she had
Uh,
like encountered like 3 or 4 miscarriages by the time
mm,
she got to me. And then I remember asking her, I said, so, what is your family? I was like, well, how is your husband taking it? And he wasn't taking it so well, right?
right.
Um, Dealing with it in his own way, and it was interfering with their intimacy. And then I asked her, I said, so well, how's your family supporting y'all? And she was like, it was like a silence. It was
Mm,
like, mm, you know, they check in, you know, and I have a feeling her family doesn't really know like what they're going through because it's such a
right.
taboo topic. Even though the family may suspect, right? Because they've
Right.
been married for a certain amount of years, people start to, wonder. But I don't think it's
Mhm.
something that they're openly talking to their family members about. And so she is literally dealing with her own issue while
Right.
also worrying about his health because he has health issues, while and also dealing with the fact that he thinks it's all on her. Like he
Uh,
thinks it's she's the issue when it was clearly both their issue. And so
right.
and then I asked her, has the doctor not had the discussion with you about both of y'all um needing attention for this to be solved? And she said, no. She said, I've seen doctor after doctor and they haven't tested him, they haven't questioned him. And
Wow.
he's dealing with the isolation of that too. So not only does
So
she have,
he's not even part of the process.
huh? He's
He's
not
not.
even part of the process.
Wow.
I see that repeatedly. That is one
That
of the
blows my mind.
major issues when it comes to fertility challenges. Is there's a lot of sexism, bias, misogyny within the medical model when it comes to um, the treatment approach. It's centered on the woman, and rarely ever is the man getting like as basic. We're talking just a basic semen analysis that they're not even doing. It's just like, okay, let's test you first, and then if it doesn't look right, then we'll base it off that. And so she's just carrying the load of the whole thing the entire time.
Now, do you find some of that gender and systemic issues within the treatment of infertility with female physicians as well?
That's a great question. I have not, like, knowingly, I have not. Most of the women that I talk to have seen male physicians. I
That
can't
blows
think
my
of
mind.
yeah, I can't think of one that like has seen female. There aren't a whole lot of female IVF doctors. I think that's
Mm,
part of it. There aren't a lot of IVF clinics to begin with. There's like when you compare the need to the demand, there is more demand than there is actual supply of IVF doctors, for one.
mhm.
So yeah, I can't speak to that. I can't speak to that, but I wouldn't be surprised. I wouldn't
So
be.
someone without the economic means, they're essentially just left to deal with the grief of not
Mhm.
having a child that they want.
Yeah, I mean it's
Wow.
yes, that's essentially what it comes down to. And it's really, really sad. I met a woman who is a therapist, and
Mhm.
she has a client base that deals with infertility. And so she's told me that, these women like fall into like really, really, really deep depression, like extremely deep depression. She's seen couples go through a divorce because of it.
Yes.
So it's disheartening, and that's one of the things that I my clinic strives to solve for, is
Mhm.
making fertility treatment accessible and affordable, because
Okay.
most of the time most of the time, IVF is not indicated.
Hmm.
It's not indicated. And that's why I call myself a middle fertility doctor, because what's happening is when they leave the gynecologist and they go to an IVF doc, the gap is who is looking at the root cause of why you can't get pregnant,
Right.
and who is addressing the health issues that need to be addressed in order for you to get pregnant.
Right.
That's where I come in, because right now the conversation is too narrow. Like the focus is on what are your ovaries doing and what is your testes doing. But
Mm.
fertility, it operates on a full system. I'm not just looking at your ovaries. I'm looking at your stress levels for one. Like, what is your nervous system doing? What mode is it in to begin with? Is it even in reproduce mode? A lot of times it's not. So let's get it into reproduce mode. And so we have to do a lot of work around that. I look at thyroid, I look at gut, I look at environmental toxins, right? I look at all of those things. And when those things are addressed, fertility just like it just easily restores itself. And I believe in the intelligence of the body. What I say is give the body what it needs for it to heal itself, and then let the intelligence just do its thing. And so that's why I call myself the middle fertility doc, is because that's the gap. And a lot of the times people don't need to go out to IVF. They need help with their health.
Mm. So rather than you create a natural cleansing environment where people get to cleanse their lives, their bodies, their lifestyle.
It's part of that is cleansing. A lot of that is like reprogramming. A lot of that is like repairing wear and tear of tissue, right? Because what I'm seeing that's happening a lot amongst women who are having problems conceiving is that there is this pattern of what I call premature aging. So, for
Mm.
instance, one of the ways that IVF doctors determine whether or not a woman is going to respond well to IVF treatment is they test something called AMH. It stands for anti-Mullerian hormone. And that hormone is what gets secreted in the pool of follicles that your ovaries recruit every month to recruit the main egg that's going to be ovulated later on in the cycle. So they use that as an indicator to know whether or not a woman is going to respond well to IVF. They're
Wow.
also using it very wrongly to tell women whether or not conceiving naturally is going to be possible, right? And so what they're finding is women as early as their 20s, 30s have really, really low AMH levels, meaning like the reserve of follicles within the ovaries is very diminished for her age. So
Wow.
so that would mean that a woman that's in her 30s has the AMH level of a woman in her 40s.
Wow.
See what I'm saying?
That.
So there's a pattern of premature aging happening. And so the question is like, what is at the root of that? That's not normal aging. That's abnormal aging.
Right.
You should have more follicles or more reserve in your ovaries than this. What's really going on? And so um there's just a pattern of that premature aging process, and that's linked to chronic stress. I link that to chronic stress.
So are you able to reduce, not reduce, what's the word I'm looking for, to be able to reverse that process so that they're able to stimulate? And does that decrease the body's age for the reproductive body's age?
Right, right. I love that you asked that question, because I like to think of the work that I do is I reverse premature reproductive aging. Excuse me. And
So there's hope.
there is hope, but that's not the mainstream conversation. The conversation is usually like it's hopeless. It's a hopeless case, right? And so let's rush you to IVF before you run out of time. And so even though women are like can't afford it or most women don't even want to go down that route. That's the whole conversation. They be like, I
Too
don't
much
want to
grief.
go. Yeah, I don't want to go down that route. Is there something else that I can do? And what they're being told in the doctor's office 9 times out of 10 is that no, there really is no other option. IVF is really the only option for you. So the conversation is very narrow. And so these women think that they don't have much of an option because the system is telling them they don't have much of an option. The women who find me are usually the women where they're told IVF wouldn't even work for you,
Wow.
right? Because your AMH levels is so low, we can't even help you, or you're gonna have to get an egg donor. And they're like, egg donor, I'm not doing that. And so they go to like looking, right? And then they find me.
Mm-hmm.
So that's how that happens. But what needs to happen within the medical system is there needs to be a middle person that the gynecologist refers their patient to before they go to the IVF doctor. Like IVF should be the very, 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 very last option because
Okay.
there's so much that we can do before then.
So if I'm understanding what you're saying, that if you had a magic wand and you could overhaul the present medical model, that systems would have that middle doc in there, or have referrals for those middle docs, and it'd be much wider and more accessible. Is that correct?
Exactly. That's exactly what I'm saying. And, I came across an article on LinkedIn. It was written by a collective of reproductive endocrinologists, IVF doctors, nurse practitioners. I think those are the main ones talking about they're projecting that they already see the writing on the wall that infertility is just going to become more and more of an issue.
Wow.
And they're like, it's not enough of us. So we have to figure out how to shorten the education and get more REs in the field because we cannot serve the need. And a lot of people are not getting the help. There was like a literal article on that. And so what they're proposing is training for OBGYNs to become IVF specialists. And also, I forget the word that they use, but essentially they were saying, let's bring in like nurse practitioners, like let's train them and let's train these other people to come and support us because we're not enough. So if there was this middle person, it would solve a lot of that issue, but that's just not the case right now. Maybe that'll be the case, down the road. You know.
One of the questions you've stimulated for me is just mental health, healthcare. We always seem to be very reactive, and when there's a problem, now you need to use us instead of being very proactive. Is there in your mind, in the innovation of the system, what would it look like if we helped people to not get into the state where their bodies are overaged? Is that even a thing?
Well, I'm going to start with female fertility.
Mhm.
For female fertility, it starts with educating women about their bodies, educating women about the menstrual cycle and what
Mhm.
it's there for, educating women on how to not just um, suppress their menstrual cycles to prevent pregnancy, but how to preserve their fertility. Like how
Mhm.
do I preserve it so that it's ready for me it's there for me when I'm ready to have children. There's a lot of research that shows that what part of the aging is women being more educated on how not to have periods, like how not to get pregnant versus like no education around like how do I preserve my fertility for later on. So that's where it starts, getting rid of the taboo around women's periods and women's menstrual cycles and accepting the fact that our menstrual cycles are there for more than just having babies. Like there's tons of
Mhm.
research that shows that a woman's menstrual cycle is like a fifth vital sign. So you know how you take the heart rate to see how your heart is functioning and everything, and take the blood pressure to see how it's functioning.
Right.
Same thing with the menstrual cycle. There are certain signs that if a woman learned how to pick up on it earlier, she would know how to address it a lot earlier and preserve and keep it from aging so fast, right? But
Wow.
because there's no education around that, um part of it, like part of my work is also that is like bringing more awareness around women's periods and menstrual cycles and the fundamental role that it plays on our health. Like I give you an example. Right now, women only care about ovulation when it's time to have babies.
Mm, true.
However, ovulation is there to to help to make sure that our hearts are healthy as we get older, to
Hmm.
make sure that our bones are healthy as we get older, to make sure we age well. Because without ovulation, we don't secrete the hormones that's needed for the body to age well. And you don't hear talk about that. You just
No,
when
I've never heard that.
you think babies, but it secretes hormones that the entire body needs. Brain function. Let's talk about mental health. This is one thing that like irks my nerve, that when we talk about like mental health, especially for women, and no one's talking about the menstrual cycle, I'm like, it is directly tied to mental health. For instance, if you notice, we talk about PMS a lot, right before the period, our mood, we get moody and irritable. It may not be you, but a girlfriend or somebody who, right before their period, they change into like their mental health goes down and they change into like they get depressed, really get
Right.
depressed. The reason is because during that last phase of the cycle, the hormone progesterone goes down.
Mm,
Progesterone is what helps us stay calm and relaxed, prevents us from feeling anxiety, allows us to sleep. But if that hormone is deficient in that last phase, she's gonna have issues sleeping. She's gonna have cognitive issues. She's gonna be moody. Like it's gonna affect her mental health. And
right.
so we need to bring in the conversation of the menstrual cycle and ovulation when we're talking about women's mental health. Otherwise, we're missing a really, really big piece of the puzzle. And it's really not our fault. It
Right.
really isn't, because we're in a medical model that's very male centered, right? Like most research is done on men.
Hmm.
People weren't forced to do research on women until like recently. So a lot of the research that we see on things is very male centered, because a lot of scientists, quite frankly, still don't understand the woman's body. They still don't understand it, right? And so there isn't a whole ton of research.
So that brings up another question for me. I feel like a curious cat today. I was so surprised when I discovered, so I have a very young adult, but when I discovered that pap smears are now given much later, like I got them as a middle-aged teenager, I guess, so to speak, and now I'm hearing that that can be delayed, and I'm wondering, does that also mean a delay in the education of young women about their bodies and their menstrual cycles, and what's the impact of that?
That's a great question. I mean, the question of like, does it I, I'm trying to think, what did I learn about my body getting PAPS? I learned about cervical health, like the importance of cervical health, right? Like that's all I learned. Like I didn't learn anything.
Well, because you were studying, you had a medical track in high school, correct? You feel like your education was an anomaly rather than the standard for where you attended.
True, true. But when I say but so in even in my medical studies, there was a lack of education around women's bodies.
Wow.
So so there was a lack there. Um, but I'm talking about like, because I had PAPS earlier on, what I learned about my body beyond what I was like learning in the classroom was like the importance of cervical health. And it was because like I had abnormal PAPS. And so I was doing research on like what that meant, right? And
Mm-hmm.
because it became like a long history of abnormal paps, there was concern on my part, there was concern on my physician's part, so I really had to dive into what that meant. And so that's how I learned about like the importance of the cervix. But even then I didn't know the importance of like the menstrual cycle when it came to cervical health. Like I later learned that hormones play a part in cervical health, but no one was having a conversation with me about that, you know?
And I bet you are just blowing a lot of people's minds right now, these questions and things they never knew. And how does one begin to educate themselves if you're a young woman who just
Mm.
wants to know regular health, or you're interested in your fertility? Can you get it from your physician normally? Or is there, like you said, there's a gap in the knowledge? How
There's
do
a
we
gap.
begin?
Yeah. You have to step outside of the medical model, to be honest, because what people have to realize when it comes to women's health within the medical model, women's health, um, gynecology, and gynecology is surgically based, right? Like it's surgically based, and so learning about women's health through the viewpoint of gynecology, a lot of things get missed. And
Mm,
so that's one thing people need to realize is like you can't really rely on your gynecologist to teach you about like your menstrual cycle. They don't get like advanced training in it, really, like beyond like what's the normal length and like what's the normal amount of bleeding.
right. How do I identify what's wrong? That's what they get. Wow.
It's so to answer your question, where do you go? There are lots of women who are menstrual cycle advocates that do a lot of teaching about it. Lisa Henderson Jack is a Black woman who has a podcast. It's called Fertility Friday. You can go on her website, listen to her podcast. She has a book called The Menstrual Cycle, the Fifth Vital Sign, optimizing the menstrual cycle for fertility, or something like that. Amazing, amazing, amazing. Another woman is I don't remember the name of the author, but there's a book that's really popular. It's called Taking Charge of Your Fertility. Is I recommend getting that. I actually have it on my shelf. Starting in those two places will get you very, very, very far.
Wow.
Very, very far. Yeah.
And I assume that you do some education around that. So
Yes, I do. I actually like part of like when women become my patients, like they leave like I know so much more about my body. Like like and not only that, they're like now when my period comes, I'm excited because they're more connected to themselves. I call it they're more connected to their femaleness. Like they're more connected to what's happening. And they feel like they're in more control of their health and what's happening as opposed to just being in the complete dark. So and I use the menstrual cycle as a way to determine whether or not a woman is responding well to my treatment, because at the end of the day it is the barometer. It's your menstrual cycle is your health barometer. If you're not
wow.
tracking it, start tracking it. Find them people that I just talked about, track it right away. By tracking it, you can pick up on cervical cancer a lot earlier than any diagnostic test can.
Wow.
Yep, there are signs. So it's such a vital tool. It's such a vital tool. So it's in the center of the work that I do. I'm very passionate about it.
So I want to ask about another one of your passions before we leave.
dance?
Yes, I'm so curious about how dance plays a role in menstrual health, in
Mhm.
fertility, in just wellness in general, and how someone begins to incorporate movement.
Mental health, fertility. What was the other part? What was the other thing? Mental health, fertility, and just
Mental
health
health
and
and just wellness in general.
wellness in general. Well, so dance, man. So the way that I talk about dance is different from exercise. We're very familiar with exercise, but
Mhm.
there's exercise and then there's movement. Scientifically, movement is different than exercise. It's what do they call it as? It's called neat non-exercise activated thermogenesis. Essentially what they're saying is you can burn calories by simply focusing on moving more throughout the day. And
Mhm.
science has shown that movement like walking can be more effective than exercise because movement is very effective at keeping that stress hormone cortisol regulated,
Right.
right? So walking movement is far more effective at keeping stress levels down than exercise because sometimes exercise can actually induce cortisol, but depending on what type of exercise and what is the metabolic health of that person, right? So it's a little
Mhm.
riskier. So I categorize dance into the movement category
Mhm.
in terms of that. So dance is really really good with preventing burnout because it regulates the stress hormone cortisol so well, right? And sacred movement. So to me there's like
Mm.
dance and then there's sacred dance. Sacred
Right.
dance to me, the way that I categorize sacred dance is I look at like ancient traditions and I see like what were our ancient mothers doing, like what were they doing to preserve their fertility, like what are the practices, what are the ancient practices, right?
Right.
And I got into that because I was born a dancer. I've been dancing all my life, and one elder told me that part of my work on this earth is going to be to link dance to medicine and healing. And so that's how I got into studying like ancient traditions. And in the ancient traditions, there's this sacred dance called the Yanvalu. The Yanvalu is a movement that mobilizes the pelvis and the spine,
Mm.
right? And so remember earlier I was telling you that most people who are having fertility challenges, and I would say also probably most people who are dealing with burnout, have a nervous system dysfunction.
Mhm.
Well, your nervous
I would
system
agree.
resides in the spine.
Mhm.
Most of your nervous system resides in the spine. So that dance, I I when I workshop it, the reason I teach women how to mobilize their spine and their pelvis to regulate the nervous system.
Mm.
So in terms of how does it help with fertility, mental health, and wellness? Well, with fertility, it helps women shift out of that fight or flight and into that rest, digest, and reproduce because I'm regulating that nervous system, right?
Right.
Pushing them into that. In terms of mental health, it promotes a sense of relaxation, that it reduces anxiety, it puts you into your body. A lot of mental health issues has to do with like thinking about like the future, thinking about the past, but like well, let's can we be here? Like can we,
Yeah, that
you know what I'm
anticipatory
saying?
anxiety
Yeah,
can
yeah,
be a
can we
killer.
be here? And there is no better movement than dance, particularly dance of the pelvis and the spine that puts you in the here and now.
Mm.
And it lets that anxiety fall away. In terms of wellness, listen, like more energy, more focus. There was a time in my life, so when I was burnt out after med school, like completely flatline burnt out, like couldn't get out of bed most days type of burnout.
Wow.
It was bad. And I was taking supplements. I was like doing all, and it was like nothing was happening. And then the pandemic was another like burnout for a lot of us, right? And
Right.
so like,
Especially healthcare. Oh my goodness.
especially healthcare, I was like, something's got to give. And there's a knowing, there's an intuition. I don't know, like if you believe in like intuition or follow your intuition, but there was a strong
Absolutely.
intuition that said like, it's time for you to like get into dance and be serious about it. Like literally wake up every morning and dance. If you don't do anything else, that is the most important task of the day. So I said, okay, that's what I'm going to do. Within 2 weeks, I was like a different person. Like I went from like being depressed, if I'm being honest, crashes throughout the day and just not able to sustain my energies, to like waking up pretty easily, sustaining
Wow.
my energies throughout the day. And I told my girlfriend, I said, I feel like a completely different person. I feel like,
I have a friend who did her whole dissertation on it. And I don't want to butcher it, but there were 5 specific dance moves that she talked about for mental health and wellness and healing and how it gets rid of trauma. And it's really quite interesting. So I love that from a medical standpoint, you're showing that there's some support and just some practical validation with your mood and the way you feel and your mindset and attitude just changing by
mm-hmm,
implementing that. And like you said, I'm sure the cortisol goes down, the
it's down.
fertility gets better. That's beautiful.
Yep. Yep. So,
Is there any last words you'd like to leave our audience with?
uh, if you're listening to this and you're burnt out, know that doesn't have to be your permanent state. I've been there, and it could feel, uh, it could feel like nothing's ever going to change. Um, but things can change. Focus on walking. Start with walking. If you can start with just walking daily, if you can walk out in nature, that's even more effective. There's a lot of research on nature walks being extremely effective at reducing cortisol and helping with burnout. I'm assuming that burnout means, like low cortisol levels and low energy levels and things like that. So there's a lot of research that supports it, and not power walking, just a leisure walk. Not this, just take it slow. Um, and then you'll start to see some shifts. It's the simple things that tend to be very effective when you're talking about treating burnout. Very simple things. Um, what else do I want to say? Um,
Well, you've given us tons of nuggets.
yeah, I feel like I've said everything I wanted to say. I've said everything that I wanted to say. Start small. Start small.
Start small. Well, thank you so very much for being a guest. I know that someone is going to take a different path with their menstrual health, with their bodies. They've learned so much. I've learned so much listening. And so I want to thank you for that. And
Mhm.
where can we find you?
Yeah, if you are interested in more of my work, you can find me at shedoesmedicine.com. And I am on Instagram as she_does_medicine. So those are the two main places that you can find me. If you just want to get into direct contact with me, you can reach me at dr.k.duga@shedoesmedicine.com.
Thank you so very much.
You're
Thank you for joining us, everyone, at Leadership Beyond Burnout. I'm your host, Dr. Kimberly L. Wilson. You can see us every week on Thursdays at 5 p.m. Eastern, 2 p.m. Pacific, right here on E360 TV.